Thank you very much, everyone, for being here today. I want to start by thanking our first responders, Boston Police, Boston Fire, Boston EMS, for the work that they're doing every day, but also for the parade of vehicles that they held on Wednesday night in support of all of our medical workers. All of your stations carried. I want to thank you for that. Our public safety community took time out at a very difficult moment for them to show appreciation for fellow frontline workers. That said something about how selfless they are and the example they set for all of us. I also want to thank all the officers as well as first responders here in Boston, throughout part of Eastern Mass, for the send-off held yesterday for Officer Jose Martinez in passing his body to the funeral home. We continue to mourn his passing, and our prayers are with his family, and we stand with the first responders, healthcare workers, frontline workers at this time. I don't have updated numbers for today in Boston, but I will go over the latest numbers that we have. As of yesterday, there were 32,181 cases in Massachusetts. That was an increase from 2,263 from the day before. The numbers of deaths statewide in total was 1,245, up from 137 from the day before. As of yesterday in Boston, the cases were 4,763. That's up 235 from the day before. Deaths were 122, and that was up 17 from the day before. For people that want to get the latest information broken down, including demographic data, both cases and people who have lost their life, you can go to boston.gov/coronavirus to get the information that we have. We're also releasing another weekly report later today with new neighborhood breakdowns. What we continue to see is people under 40 make up the highest percentage of positive cases in the city of Boston. So I just want to continue to stress to every single person that's at risk for getting ill or passing on the virus. Every single person needs to continue to practice social physical distancing. We're at a critical period of time. Our numbers continue to surge, and they're not expected to peak until the end of the month. That means that we have to do everything we can during every single day, because every single day counts to flatten out the curve, conserve our medical resources, and allow our healthcare professionals to do their life-saving work. We're asking everyone to keep doing the right thing by staying home, washing hands with soap and water as often as possible, covering your face when you go out, whether it's a mask or a scarf or a bandana or just a t-shirt. Give people 6 feet of space between you. If you're going for a walk and you see people, make separation so you can pass each other. The infection that we prevent today, in many cases, will be the hospitalizations that you prevent 2 weeks from now. As we know, Monday is Patriots Day. It's not a normal Boston to be home this weekend. Patriots Day is about a moment in history when Bostonians led the fight and sacrificed for the greater good. It's a time when we celebrate as a city. We need that spirit again right now. We need to stand together by staying apart. It looks like we're going to have, over the course of the 3-day weekend, some bad weather, and then we'll have some good weather. We're asking people, regardless of the weather, to stay home. I'm asking you, please do not run the marathon route. People have been talking about that and saying that, and I know that the governors probably talk about it today, and other city officials. That's not a smart thing to do. That's not a safe thing to do, and you're certainly not setting a good example by doing that. If you have an idea, then you can be certain that hundreds of other runners will have the same idea. So we're asking you to do the right thing. Let first responders focus on their needs, and I'm asking everyone to save your energy until September 14th. We're going to keep getting the stay-at-home message out every single way we can. And we're going to continue to targeting the places where data shows us that more outreach is needed. We are mobilizing all of our resources in that work, our physical resources, our human resources, and our community responses. We have nearly 200 digital and print billboards up across the city. We've delivered literature in multiple languages to every home in the city of Boston. We're calling close to 80,000 seniors twice a week with a message in 6 different languages. This weekend, we're launching new tactics to get the message out in the places that we know are the hardest hit. We're sending out 7 sound trucks. These 7 trucks, city truck mounted speakers, will be delivering and driving through the neighborhoods where the cases are the highest. You'll hear them in Hyde Park and Mattapan, Dorchester, East Boston, and Roxbury. They'll be broadcasting a message in 7 different languages depending on the community: English, Spanish, Haitian Creole, Vietnamese, Arabic, Somali, Cabo Verde Creole. We've also begun phone banking small businesses. We're using the network that our small businesses have as is built to reach our small markets. We're providing posters in multiple languages that ask customers to cover their face and practice social distancing. We're also increasing signage around the city. The signs that the Parks Department put up at playgrounds, we're also putting those on street signs and other infrastructures. We're planning another literature delivery in multiple languages. This message from the trucks, the posters, the signs, the literature is the same one I want to deliver today. We are in a public health emergency. We need you to do your part. Stay at home. Wash your hands with soap and water. Cover your face outside the house. Practice spacing and avoiding all crowded situations. And call 311 if you have any questions or concerns. We're urging all people to do their part, but we also want to make it clear we have resources to support you. Making sure that everyone has access to food every day is something that we have prioritized since the very beginning of this crisis. We have a total of 65 youth-oriented sites, food sites in the city. They are operated by the Boston Public Schools, the Boston Center for Youth and Families, the YMCA of Greater Boston, and the Boston Housing Authority, as well as other organizations. We're coordinating with them out of my office to help. We have help from the BPDA, Boston Planning and Development Agency, and the Office of Food Access, all collaborating together. It's an impressive collaboration of providers all across our city to feed the young people of Boston, and I want to thank all of them for their work. I want you to think about this. I was on a call earlier today, and I want you to think about this. So far since this crisis started, those sites have fed over 400,000 meals to the young people of our city. BPS alone has provided over 200,000 meals, and they're delivering meals to students with special needs. We're going to keep phasing and expanding services in response to the needs that we are tracking in different parts of the city. We also have seniors and families and individuals picking up meals at dozens of food pantries. They're supplied by the Greater Boston Food Bank. We're delivering meals to veterans, and we're providing easy-to-use information at boston.gov/coronavirus under food resources, or you can just simply call 311. Whether you're a parent, a senior, or anyone, we can guide you to a resource. We want to be helpful. We are not willing to let any single person go hungry because of this crisis. And I just want everyone to understand the magnitude of what this crisis does. It truly points out our most vulnerable in society and the need for government to help with the most vulnerable, to allow them to, first of all, get food, keep a roof over their head, and make sure that they feel safe during this crisis. I want to thank all the people that have helped me do this and help us do this here in the city. I also want to share a new initiative to support seniors. The Department of Neighborhood Development partnered with a company called Nesterly. They're matching young adults as roommates and tenants for senior homeowners. Right now, we can't house young people with seniors, so we responded by launching a service that matches volunteers with seniors who need things like grocery delivery, medication, or just a good old-fashioned phone call check-in. It's called Good Neighbors. We are working with our Age Strong Commission to connect with older adults, and they're recruiting volunteers and safely providing protocols. You can sign up with this request to help or to volunteer to help your seniors at nesterlygoodneighbors.com. That's nesterlygoodneighbors.com. I also want to give you an update on what we're doing to increase capacity of our medical system. The Boston Hope Medical Center at the BCEC went into operation last week with 1,000 beds. As of last night, Boston Hope was treating 133 patients, including 55 homeless individuals and 78 subacute hospital patients. In total, it's already served 172 individuals, including 39 who have been treated and discharged. It's a facility that's serving its purpose well and still has the capacity to spare. We continue to staff it up so that we can fully meet the needs if we need to meet the needs of the capacity. We will continue to prepare for whatever needs arise for a safer shelter and treatment space for our most vulnerable residents. Ultimately, testing is how we will get through the next stage of the situation. It's an essential part of our equity strategy. Every community deserves full access to the level of testing and communication that meets the needs they have. So we continue to work on expanding access to testing for our residents. Our partners are Boston's world-class hospitals and community health centers. They are trusted and relied on by our residents in every neighborhood of our city. In many cases, we've been able to jumpstart these partnerships with grants through the Boston Resiliency Fund. As I said before, Whittier Street Health Center in Roxbury, it began testing for all on Wednesday. Yesterday, testing became available for residents in Hyde Park at the Brigham and Women Faulkner's Community Physicians Facility. They were able to test 90 people yesterday. Bowden Street Health Center in Dorchester opened their testing sites as well yesterday. Today, the testing sites for first responders in East Boston is expanding to serve residents in the neighborhood. That partnerships with the East Boston Neighborhood Health Center. Common Square Health Center in Dorchester will have testing available starting this weekend. We're also supporting Mattapan Community Health Center, Uplands Corner, and Dot House Health. And we're in talks with Harvard Street Neighborhood Health Center in Dorchester and the Demick Center in Roxbury. We're also going to be developing a testing access map to make it easy for residents to find out where they can get tested. It will provide locations, hours, and guidelines for how to get tested. This map will be online by Monday, and we'll be updating it as new sites become available. And I just want to give a special shout out to all of our health centers who have really offered in a big way their facilities. They do incredible work in our communities already, and the fact that so many of them are allowing testing going on in their facilities, I want to thank them for that. I want to close by sharing another resource serving children, families, and people in need. Many people rely on the Boston Public Library branch for access to books and other material at no cost. We have a wealth of material available online right now at bpl.org, but not everyone is able to get set up with Wi-Fi and online resources. When you're doing the right thing, staying home or in a tough situation, you need and deserve access to books, art, and even more. So we launched a program called Books for Boston to meet the needs. The Boston Public Library is safely delivering new children and adult books to a variety of nonprofit organizations that serve people in our city who are at a higher risk during this pandemic. We've already delivered over 1,400 books with a goal of 5,000 in all. The books are going to homeless shelters, including our new facilities, family resource facilities, senior housing buildings, and domestic violence shelters. We are looking for more partners, and we're buying all of these books at local bookstores that have lost business due to this crisis. We're coming together as a city, and we're certainly rising to the challenge. Whether it's food, books, medical supplies, or testing, caring for our most vulnerable, caring for our seniors, we're pulling together and drawing our strength on as a community. We're activating these networks and these relationships in ways that we never thought possible or thought necessary. This weekend, we celebrate who we are as a city. We're doing this differently this year, but I could not be more proud and more grateful of the spirit of giving and togetherness that we have here in Boston. On another note, to change gears from the coronavirus, we're expecting tonight 2 to 4 inches of snow in the western parts of our neighborhoods and up to 2% on the coastline. It'll be, if we get over an inch of snow, it'll be the first time in 20 years that we got snow this late in the season. It's actually fun to talk about snow, so I'll take any questions you have on snow, and we can move on. But I want to seriously just thank everyone for the work you do, and open up for questions. Yeah, the question is, what's the future of colleges in the summer and fall program? Is there any guidance? Are we thinking about it? I know that we're going to be setting up a call with the college presidents. I'm going to have one with them, I believe, next week to talk a little bit about what they look like potentially in the fall. I was asked yesterday, I forget where it was, I think, by CNN, one of the news people, and what I said was I think colleges have a little bit of an advantage to actually have classrooms and social distancing if need be, because they can be spread around. I think their issue will come with dormitories. Sometimes if you have single rooms, you're fine, but if you have roommates, but I'll have those calls with them next week. I'm sure they're thinking about it. They're doing a lot of online now, and I'll report on it next week after the call.
Could you talk a little bit more about hospital capacity? You mentioned BCEC, but where are the hospitals?
Yeah, Yeah, I'm going to ask Marty Martinez, Chief Health and Human Services, to touch upon that.
Thank you, Mayor. Yeah, as you know, we have constant contact with our hospitals in terms of their bed capacity, their ICU bed capacity, their ventilators. There's no question our hospitals are seeing an increase in the census and the number of people who are coming in, and their most serious patients right now are COVID positive patients, both in their ICU beds and those that are using ventilators. But again, they're managing the surge that we're in right now, working together with each other to share resources and to make sure that we can monitor where they're at. And they're able to do that right now adequately, but of course we're closely monitoring to make sure they can support it. The BCEC site, or Boston Hope, helps us to be able to transfer patients there to free up more space in the hospital. So as of right now, they're managing it, but it's an everyday situation.
Alternative locations are going to be needed.
Well, of course, we don't know for sure, right? We can't speculate whether they'll be needed, but they're there. They're accessible now, right? So we have 1,000 beds at Boston Hope. I think we have roughly 100, maybe 100 or so folks, a little bit more than that, there now. So we're ready and able to take them on if necessary. And the same is true for the ventilators that have been able to share between each other. So we're ready for this capacity that may be needed. We hope we don't need it, but we're ready for it.
Yeah, the question is, the state of New Hampshire canceled school for the rest of the school year yesterday, and then the follow-up to that, any plans for summer school classes? As I said yesterday, I'm waiting to talk. We're talking to the governor, and I think that decision really needs to be made collectively. When we canceled school in the very beginning, it was a little different situation. Boston canceled. We were one of the first to cancel it. We canceled it for the longest time at that particular time. But I think when it comes to schools now, I think it has to be uniform across the state. I think it makes more sense. And I know I had a conversation with the governor a couple nights ago, and we're going to follow up today, talk more about it. But I would expect that decision coming in the next few days. In summer school, we're planning, our superintendent, I spoke to her last night as well, we were planning what would school look like if it was called back to school this year, and we were also planning what summer school looks like, and I still think that in some cases a little too early to tell, because we have to look at the data to see where we are in those particular months as far as the surge and as far as the positive case we have, and if the decision on testing, do we have mass testing at that point. So I think as we move forward, they're thinking about it, but we'll have more concrete answers probably in the next month or so as far as summer school goes. Yeah, the question is on the PSA yesterday about not running the marathon route. Have I been hearing anybody talking about running, and what happens if you do run? People that are planning on running the marathon itself, they're all champions, in my opinion. It's an amazing run. Many of them run for charities, for organizations. Some people run for themselves, for their own spirit, and they're all champions. If you run the marathon, if you try to run the marathon route Monday, you're not a champion. You're actually not helping us. You're putting people at risk. You're putting first safety responders at risk. We're worrying about keeping the spread of the virus. It's not a great accomplishment. You're not going to be celebrated for it. No one's going to be clapping for you. And I would ask you not to do it. There's no need to do it. Even the most avid runners out there, and a lot of my friends are the most avid runners, I would say do not run the marathon. It's not the right thing to do this year. If September 14th is the marathon date, we're hoping that we're going to have the marathon. That will be a day to celebrate and cheer and yell and scream and be happy, and something that we'll be proud of you doing it. But I just can't stress enough people thinking to run the marathon. It's just not the right thing to do. And if you run it, I mean, I don't know what the situation is right now. We'll have more conversations as the weekend comes. But it starts in Hopkinton, ends in Boston. We won't be celebrating you here in Boston, I can tell you that. I mean, we'll see. Again, I don't know. It might not be a problem. Maybe people get the message right now, and people might think, well, I'm still going to run the marathon. I don't care what the mayor says. Well, that's fine. But on Monday, think about your family and think about someone other than yourself. No, nothing's being closed. I mean, there's cars on there, there's bikes on there, there's people walking on there. I mean, you're running at your own risk. There's no shutting down, there's no public safety, there's no barriers, there's no blockades, none of that stuff. There's no starting line, there's no finish line, there's no race people on the route making sure that you're okay. There's nobody cheering you on, all of that stuff. None of that's going to happen Monday. Yeah, the question is, I'm going to have Marty answer it. The question is on the Health Inequities Task Force, any insight on what the latest they've worked on? Some of it is what we're talking. I'll let Marty do it, and I'll follow up.
Yeah, so the Health Inequities Task Force, which I think's been in existence for about a week, maybe, they've had 2 meetings already, and they've been working to lift up how to analyze and understand the data. What we've started to see in our case data, which shows the disparities, the death data, which we started to release, how to understand what the neighborhood-specific level pieces are. They've lifted up suggestions and started working through some of the community mobilization efforts the mayor mentioned about neighborhood-specific targets, expanded testing, and they've also started to lift up some of the economic impact of the mitigation efforts that we've had. So we've been working with them, connecting with them, and using their expertise. There are community leaders on it, there are faith-based leaders on it, there are community health center folks that lead it. So it's been a really valuable way to bring in the perspective and the voices. We also just today had a webinar for the Haitian Creole community with pastors and faith leaders, and then right after this have a call about the Asian American impact of COVID here in Boston. So again, doing a lot to make sure we lift up all the individual pieces that are there.
Any other questions? It's going to start this weekend, on Saturday. The question was on the sound trucks going through the city of Boston. That's going through this weekend. And one of the things that we want to do is, for the different languages, is that there's definitely a language barrier and there's a cultural barrier sometimes. And I think that we want to stop the spread, or slow the spread of the virus, is making sure that people hear it in their own language, their own tongue, that they understand the importance of this as well, and make sure that people are safe. All right, thank you, everyone.